Well, so this study, as really most of my research, starts with my patients. So our patients were enrolled through 42 centers worldwide. We had sites in not only the United States, but a number of sites in the United Kingdom, as well as Canada, Australia, and New Zealand. You know, I had a couple patients when I was first starting out who had been diagnosed with various heart problems, and I'm primarily an electrophysiologist, so I take care of a lot of defibrillator patients, and these two young people had received defibrillators, and I said to them, well, you know, I'm sorry, but now you're going to have to stop doing sports, and they were both shattered. And one of them said to me, well, I'm going to stop doing sports if you show me data that it's dangerous, otherwise I'm going to keep going. And I said, you know what? We need to compile this data. We don't even know the answer to this question. And so it was really started with patients and trying to make their lives better. I would say go with what you really care about, because that's where you're going to want to put your energy and you're going to succeed.
Well, I love taking care of patients at risk of sudden cardiac death from a variety of genetic heart diseases, particularly long QT syndrome and hypertrophic cardiomyopathy. And so that's the beauty of having a hand-glove relationship where, as director of the Winland Smith Rice Genetic Heart Rhythm Clinic at Mayo, I get to take care of these patients, and I love doing that. But I also love the questions that they inspire me to get better answers for. And so that's our role with the complementary Winland Smith Rice Sudden Death Genomic Laboratory. So taking patients with their diseases, answering the unknown questions that they have, whether it's at the translational level or whether it's at the basic level, finding new disease genes or finding new determinants of risk. That's the beauty of doing true translational research, where you get to be both physician and scientist, and so the combined is really something that I enjoy a lot. Well, I think the advice to the young researchers out there is that there's two fields in cardiology that are wide open, and we would love new future cardiologists to pursue. Genetic cardiology is one of the most exciting new subspecialties of cardiology. It's not even officially recognized as a subspecialty, but it is. And so I've been calling myself a genetic cardiologist for over 20 years. And sports cardiology is one of the younger subspecialties in cardiology. In both of those areas, the future is incredibly bright. So if somebody is intrigued about those two areas, they should seek out somebody who does them, should partner with them, should learn as much as they can about them, because the future is really bright for a sports cardiologist and a genetic cardiologist. Well, there's all kinds of challenges, but it just depends on whether you want to be an optimist or a pessimist. And so I find it to be just filled with opportunities, and we answer new questions every day. I mean, there's not a patient that the three of us see where often they won't inspire the next paper with the situation that we face in trying to take care of them. So I basically see it as a career and a world full of opportunity.
Well, like my colleagues, I'm really inspired by the patients that I've seen over the years. And with the particular study that we're presenting here at ACC related to exercise and HCM, this was an area that had absolutely no data in it. And patients were coming to us scared. They were afraid to get off the couch. They were anxious about exercising. And we just didn't have any data to help inform their decisions. So that was really the motivation behind this and other studies that I've been involved in around exercise and HCM. And so this was really more an advocacy in many ways, and that patients were being restricted and disqualified. And I just felt like that wasn't ethical. And we didn't have an evidence base for it. And so that was really the motivation behind a lot of the work that I've done in collaboration with others. And I'm also a scientist in a more molecular level, and so I'm very motivated by just trying to understand the disease better and how in the future we can make patients feel better, that we can treat the underlying problems. And so I have a laboratory where we do molecular studies that revolve around the basic biology of hypertrophic cardiomyopathy. So my advice for young researchers is don't try and go alone, and that collaboration is so important. Network with your colleagues, work with them. Don't worry so much about you have to claim something as your own or you need to be independent. I think you have much more power and impact if you work with others. There are always so many challenges, right? Time, right? Trying to fit everything in. There's not enough time in the day to try and do research and see patients. But finding a way to make it work is really important. And turn to your peers, turn to your mentors to help you to create that balance. Funding is always a challenge and it's competitive, but be persistent and be resilient. And there are just so many opportunities out there for you if you do